Our third technique in our treatment protocol for treating a pregnant patient in her second trimester of pregnancy is going to be a myofascial axillary stretch, which is going to help to improve movement within the thoracic area, but very specifically the abdominal diaphragm. Now, why are we doing this technique? Well, releasing the fascia in the axillary area not only helps to relieve tension, muscular tension, in the area that affects the abdominal diaphragm, allowing the thoracic rib cage to expand laterally, as it should be able to do when your patient inhales, but also releasing tension in this area and allowing the abdominal diaphragm to move more fully will help the nervous system of your patient to go into a parasympathetic state. So we know that when a body is in a parasympathetic state, the lymphatic system can kick in and function a lot more effectively in terms of draining fluid and helping the body be more healthy and more vital as it moves into subsequent trimesters of pregnancy. So our pregnant mom, Erica, already told us that she was already starting to feel like she was suffering from the effects of her breasts enlarging throughout her pregnancy. But as I demonstrate this technique on her, I can also see that this area, just in the axillary area on her, is actually quite tense. So she's an excellent candidate for this technique. So I'm going to demonstrate it for you now. You're going to take your patient's arm, make sure that it's loose. You're going to raise it over her head, make sure that her elbow is slightly loose, and you're going to grasp it just above the elbow. Next, with the other hand, we're going to place it in the axillary area so that our thenar eminence is contacting the axillary area, but also that our palm and our fingers are working their way all the way down to the abdominal diaphragm. So we want to contact as much as possible the axillary area, the ribs, all the way down to the abdominal diaphragm. So it's very much using your entire hand. And what we're going to do is we're going to ask our patient to take a deep breath. So Erica, please inhale for me. Take a deep breath in through your mouth. And as she exhales, I'm going to perform a stretch whereby I'm holding the muscles here. I'm stretching her arm a little bit. I'm stretching her lats, but I'm also opening up that whole axillary area. Very good. So then I'm going to release, and I'm going to ask her to take another deep breath. And as she exhales, I'm going to stretch the axillary area, the arm one way, and I'm going to press down and start inducing a stretch on this axis. So we're opening up this area. So as I simultaneously stretch the arm, when I do this, I can feel that I'm gauging the muscles in this area. So I feel it being pulled up under my hand. And with this hand, I'm going to push downwards in and towards the feet a little bit more on an oblique angle in order to have a bit of a compressing effect so that when I release, we're having a bit of a pumping effect on the ribs and on the lateral portion of the diaphragm as we're stretching the arm. So let's do it one more time. Take a deep breath for me. And as you exhale, we're going to stretch that arm towards us and push down in the opposite direction. And then we're going to release and take one more inhale for me. And exhale and relax. So I can feel on Erica that only as I get towards the end of her exhalation that I'm starting to be able to induce some kind of movement in the rib cage, in the lateral portion of the diaphragm. So she's actually quite stiff in this area, and this is what's contributing to the lymphatic congestion in the axillary area and contributing to the premature breast engorgement that we're seeing on her despite the fact that she's still in her second trimester. So one last time, take a big deep breath. She really needs this. And we're going to exhale, relax your body. We're going to stretch that arm. We're going to open up this area here. And then we're going to release. So we're having a bit of a pumping effect. Very good. How did that feel?
Very good.